Hello, everyone, and welcome to The Healthy Habit. I'm Dr. Shawn, and I'm so glad you're here. Let me ask you a question. Have you ever stood up from your chair, taken a few steps, and suddenly felt like the room was spinning? Or maybe you felt lightheaded, unsteady, or as if you were about to faint? If that has ever happened to you, don't ignore it, but don't panic either. Dizziness is one of the most common reasons people over the age of 40 visit a doctor. Sometimes it's caused by something simple, like dehydration. Other times, it can be a sign that your body needs medical attention. Today, I'll explain why dizziness happens, what is going on inside your body, and some simple things you can do that may help you feel better in just a few minutes. So, let's get started. The first thing to understand is that dizziness is not actually a disease, it is a symptom. Think of it as your body's alarm system telling you that something isn't working quite the way it should. Now, your sense of balance depends on three important systems working together. The first is your eyes, the second is your inner ear, and the third is your brain. These three systems constantly communicate with one another. Your eyes tell your brain where you are. Your muscles and joints tell your brain how your body is positioned. And your inner ear acts like a built-in balance sensor. When all three agree, you feel steady. But when one starts sending the wrong information, your brain becomes confused. That's when you may feel dizzy, or like the room is spinning. Pause for a moment and imagine standing on a boat during rough waves. Your body receives mixed signals and your balance becomes unstable. That's very similar to what happens during many episodes of dizziness. One of the most common causes is dehydration. Many people don't realize that even mild dehydration can reduce the amount of blood flowing to your brain. Your brain depends on a steady supply of oxygen and nutrients carried by your blood. When you're dehydrated, your blood volume decreases slightly, your heart has to work harder, your blood pressure can drop. And when you suddenly stand up, your brain may not receive enough blood for a few seconds. The result? You feel lightheaded or dizzy. The good news is that drinking water and sitting down for a few minutes may help if dehydration is the cause. Another very common cause is something called low blood pressure when standing up. Doctors call this orthostatic hypotension. When you stand, gravity pulls blood toward your legs. Normally, your body quickly tightens your blood vessels and slightly increases your heart rate to keep enough blood flowing to your brain. But sometimes that response is slower than it should be. For a few seconds, your brain receives less blood. That's why you may suddenly feel weak, dizzy, or as though you're about to faint. If this happens often, it's important to speak with your healthcare provider because certain medications, dehydration, or medical conditions can contribute to it. Now let's talk about the inner ear. Deep inside each ear are tiny fluid-filled tubes called the balance canals. As you move your head, the fluid moves too. This tells your brain exactly how your head is moving. Sometimes tiny calcium crystals become loose and move into these canals. When that happens, your brain receives incorrect signals. You turn your head. But your brain thinks you're spinning much faster than you really are. This causes a sudden spinning sensation called vertigo. Many people notice it when rolling over in bed or looking up toward a high shelf. Although vertigo can feel frightening, it is often treatable. Low blood sugar can also make you dizzy. Your brain needs a constant supply of glucose to function properly. If you skip meals, exercise for a long time without eating, or take certain diabetes medications, your blood sugar can fall too low. Besides dizziness, you may notice shaking, sweating, hunger, or trouble concentrating. Eating a healthy snack may help if low blood sugar is the reason, but if symptoms are severe or keep happening, seek medical advice. Stress and anxiety can also play a surprising role. When we're anxious, many people begin breathing faster without realizing it. This changes the balance of oxygen and carbon dioxide in the blood. That can lead to dizziness, tingling, and a feeling of being disconnected. Slowing your breathing and sitting quietly for a few minutes may help your body regain its balance. Now, here's something you can do if you suddenly become dizzy. First, stop what you're doing. Sit down immediately. If possible, lie down with your legs slightly raised. This helps improve blood flow to your brain. Next, take slow, deep breaths. Don't rush to stand up again. Sip some water if you think you may be dehydrated. If you haven't eaten in several hours, consider having a healthy snack. And when you're ready to stand again, do it slowly. Give your body time to adjust. These simple steps are often enough to help many mild episodes of dizziness. However, there are times when dizziness should never be ignored. Call emergency medical services immediately if dizziness comes with chest pain, severe headache, difficulty speaking, weakness on one side of the body, loss of vision, confusion, or if you faint and do not recover quickly. These symptoms could be signs of a stroke, heart problem, or another medical emergency that requires immediate treatment. The best way to reduce dizziness is to develop healthy daily habits. Drink enough water throughout the day. Avoid standing up too quickly. Eat regular, balanced meals. Exercise regularly to improve circulation. Get enough sleep each night. And if dizziness becomes frequent, severe, or keeps coming back, don't simply accept it as a normal part of aging. Let a healthcare professional determine the cause. Remember, your body is always communicating with you. Dizziness is one of the ways it asks for your attention. Sometimes the solution is as simple as drinking water and resting. Other times, it may be the first clue that something more serious needs to be checked. Listening to those signals early can make a big difference. Thank you for spending these few minutes with me today. I hope this lesson has helped you better understand why dizziness happens and what you can safely do when it occurs. I'm Dr. Shawn, and this is The Healthy Habit, where we turn medical knowledge into simple, practical habits that help you live a healthier, stronger, and longer life. If you found this video helpful, please like it, subscribe to the channel, and share it with someone who has ever experienced dizziness. You never know whose life this information could help. Until next time, take care of yourself, stay healthy, and I'll see you in the next lesson.